So when I was making this research on this unsafe abortion, I was reading about some things. They usually say manual vacuum aspiration, and I was reading about one, and they usually say electric vacuum aspiration. So I was like, oh, there might be medical students out there that want to know the difference between manual vacuum aspiration and electric vacuum aspiration. So quickly, I made a presentation on the differences between manual vacuum aspiration and electric vacuum aspiration. But to me, just using common sense, you know that manual is like you are using your hand. Electric is like something that is automatic. Do you understand? But you also need to know what the vacuum aspiration is, okay, so that you can better on put up your essay. So manual vacuum aspiration and electric vacuum aspiration are both safe. They are effective methods of uterine evacuation. Like if there's anything in the uterus, it could be abortion, okay, it could also be a woman gave birth, so there's retained placenta components, okay, there's retained placenta membranes and all of that. You want to actually aspirate, okay, but mostly the vacuum aspirations are things that are usually used for what? First trimester abortions, okay. So for the manual vacuum aspiration, it's just a handheld syringe. So I have it here. I have the picture here. This the first picture, if I upload these videos, right, if you see the first picture, it shows, well, these are scissors and this is what? A handheld syringe. So this picture also carries the manual vacuum aspiration. Then the electric vacuum aspiration is as big as a refrigerator, so it has a wire coming out from it. So like when you on it, it's sucking in anything. So when you put it in the uterus, it will suck in all those what? Fetal products and placental products. That's if you are using it in pregnancy, okay. So let's discuss them further. So the manual vacuum aspirator is a handheld syringe. There's no electricity required, and when you want to use it, you have to use what? Local anesthesia, so it's suitable for pregnancies up to 12 weeks. That's if you want to do an abortion. Because we are discussing abortion, everything I usually tilt it towards the abortion side. So if you want to use it for abortions, you take it up to if the pregnancy is up to 12 weeks, you can use a manual vacuum aspiration, okay. Can be done in outpatient or office settings. Alright, so advantages is portable and inexpensive. There's minimal infrastructure needed. There's lower risk of uterine perforation due to controlled suction. And I was telling you guys that throughout my medical career, I won't do abortions. One of the reasons is the kind of things I want to take myself into. I'll hardly even see cases of abortion. Like for me, my greatest desire to actually join the US Army, okay. So I'm actually looking for connections. If you're watching this video and you have any connection on how to join the US Army, I'm still in my 5th year of medical school, so I'm left to like 1 year. So I have this 1 year to search and make the proper connections and all of that. One of the things is, I know you need a permanent residency and all those. I'm still hustling, alright. If you give me like 6 months, I should be able to have a lot of money that can be able to buy a house in US, okay. So electric vacuum aspiration, though, this one is an electric pump. It will generate suction. It requires electricity and clinical setup. I was telling you guys, I have the picture here. It's like a fridge. It has all those big stuff on it. It has wires, so when you on it, it's sucking in anything. So that's what we got. Procedure is performed under local anesthesia. It's suitable for first trimester and also the early second trimester pregnancies. And an electric manual aspiration, vacuum aspiration, of course you can't use it outside the hospital environment. So it's what? A hospital environment related equipment. So it's more expensive, it's less portable, requires electricity. So the manual one is no electricity, is cheap. Those are just the stuff, right? But